Hi, I'm Frank Witting with Witting Insurance Agency. I'm the insurance liaison for Comal County. My office is located at 546 South Castell Avenue, right here in New Braunfels, and my phone number is 830-606-1000, fax 830-626-2664. My email address is frankwitting@sbcglobal.net. To see all the benefits for Comal County, please go to www.mybenefitshub.com/Comal County. Remember, put the S into benefits. When you enter this, it will bring you to this website. This is the Comal County Employee Benefits Portal. To see the benefits, you do not have to log in. Currently here you see the 2013-2014 plan year. Comal County provides the medical insurance free of charge to all employees. You have to pay if you want to cover your dependents. You can purchase a medical supplemental plan, dental plan, vision plan, and a long-term disability plan. The short-term disability plan is again paid by Comal County at 100% no cost to the employee. Employees can also purchase critical illness, cancer, accident policies. A basic life policy is provided again by Comal County free of charge to the employee. The benefit is $45,000 normal deaths, $90,000 for accidental deaths. The voluntary group life insurance provides you with additional insurance if you want to purchase it. There is also prepaid legal and a reimbursement plan or cafeteria plan. Comal County also provides free of charge an emergency transportation or air life program. In the middle of the screen, you will see some quick links. There are employee benefits letter, Comal County homepage, the enrollment instruction, and the benefits presentation, which is this video. Here again is my address in case you need to contact me. If you want more information about the medical plan, please click on Medical and it will open a new window. Our medical is provided by Blue Cross and Blue Shield of Texas, and here you will have plan information for the prescription drug or RX, plan information for the health insurance, benefit booklets, the rates, and an application and the change form. The plan information shows you a plan summary. Comal County's plan is a PPO plan. The policy has a $500 deductible per person per calendar with a $1,500 deductible maximum per family. To get these benefits, you have to go to a Blue Cross Choice Network provider. If you go out of network, there will be an increased amount you have to pay for your benefits. Comal County also has a fourth quarter carryover, which basically means that if you have any charges in October, November, and December of a year, and those charges go towards your deductible, then basically they also apply for the following year's deductible. There's a stop loss of $2,500 for individual or $7,500 per family. What the stop loss means, basically after the deductible, the policy pays 80% and you pay 20%, where your 20% cannot exceed $2,500. If your out-of-pocket reaches $2,500 plus the $500 deductible, then the policy will pay 100% for the remainder of the calendar year. Emergency room, the facility charge will be paid at 80% after a $90 copay. The copay is waived if you're admitted to the hospital. The physician charge is 80% after a calendar year deductible, and this is for a life-threatening emergency. The same benefits apply if it's a non-emergency situation. Then when you go to a doctor, you pay a $25 copay, and that includes any lab or x-rays. Immunization for children up to the age of 6 is covered at 100%. Outpatient surgery is covered at 80% after the deductible. Maternity is covered. Preventive care, routine physicals, well baby care, again covered at 100% with a $25 copay. You see extended care if you have to take home health care, skilled nursing home, is covered at 100%, but it has maximums on there. We also have a mental health or chemical dependency benefit. Remember that Comal County offers an employee assistant programs where you can call a physician for free. If you go under Blue Cross's program, you have a $25 copayment. A serious mental illness is covered as any illness. You can cover your dependent children until the age of 26. There is a charge for each child you cover. Children, newborn children, are automatically covered for 31 days, but you have to inform HR and fill out a form to add a newborn child or children. Our policy with Comal County has a pre-existing condition. A pre-existing condition is any condition you have seen a doctor for in the last 12 months will not be covered for 12 months unless you had coverage in the last 63 days and the waiting period under Comal County does not count. If you had coverage, then a pre-existing condition clause does not apply. But you can read this in detail. Then the prescription drug program, you basically go back to the employee benefits portal. The prescription drug program, you click here, and then you will see the benefits. Again, it's a network program where you have a $100 deductible per calendar year with a maximum of 3 per family. You pay for generic drugs $5, brand name $20, and non-preferred drugs $35. We also have a mail order prescription drug program where you get a 90-day supply for 2 co-payments. That means generics are $10, brand names are $80, and non-preferred brand name drugs are $70. We encourage you to use the mail order program because it will save you money and the county's money. Then you also have the complete benefit booklet here and the rates. Here are the current rates, and basically the county is paying for your cost $670.14. If you want children insured, the charge is $78.65 for the first child. Then 2 children is $93.19, and you can see you can insure as many children, but we only list the cost for 6 children. And these costs are bi-weekly. Same, you can insure your spouse for $158.90 bi-weekly, or your whole family with 1 child for $237.55, 2 children. You will see it here at the Benefits Hub. Now, you can enroll all your dependents at open enrollment, or if you're a new employee, and there is no questions asked. If you want to add your employees at a later time, then you only can add them within 30 days after they lost coverage. To add a dependent, basically you have to complete the application change form and turn it into the HR department. If your dependents did not have any coverage before, then they have to wait until the next open enrollment, which will be October 1st every year. If you have a newborn child, if you get married or adopt a child, then again you can add the children or the dependent with no questions asked, as long as you notify the county within 30 days and fill out the appropriate forms.
My name is James Goots. I'm a representative with Allstate Benefits. I'm going to explain to you about some of our unique group benefits offered to the employees of Comal County. You notice on my card is the email address, office number. If you wish to contact me or have any additional questions, please do so before enrolling. Thank you. All right, now we're going to talk about the Medicare supplement. Again, this mirrors your county's health insurance plan. If we come over here and we click on plan information, this is going to be a brochure of our plan. So as I scroll down here, you're going to be able to go ahead and view this information as all of our brochures on an individual basis at your own leisure. Now when I come down to the next page here, it's going to go ahead and describe as far as rates goes and everything. But what this plan is going to do for you, your deductible on your county's health insurance is $500 per year. This plan basically waives that $500 deductible. It makes it a zero deductible. As far as outpatient goes, it pays $250 a year. That's any outpatient like you went to the emergency room and so forth. So we scroll back up here and you want to know what the rates are. This is age bracketed, age banded. So again, under age 40, you got 40 to 49, 50 and above. So for an example, if, as I was saying, if it mirrors your county's health insurance, so whoever's covered on your county's health insurance has the opportunity to go ahead and get this plan as well. So an example, if you're 40 to 49 and you covered your spouse on the county's health insurance, both y'all are eligible for it. Now, if you don't want to have your wife covered on it, you want to cover just yourself, then it'd be $602. If both of y'all are, then it's $1082, and that's per paycheck. Okay? Also keep in mind, this also can be used for pregnancy. So if you're currently pregnant, and obviously you got to satisfy your deductible, you can go ahead and apply for it. Because again, as it says right here, it does not have any pre-existing conditions. Now, what I'm going to do is I'm going to show you as far as when you get back over here, you see claim forms. You just click on the claim form, and this is what you're going to go ahead and submit once you do have to go ahead and file a claim. And as far as claim filing instructions, everything's all spelled out exactly what you have to go ahead and do. Okay? So once you fill out the form, you're going to go ahead and fax it over to us. And if you need to email anything, the numbers are right there. Again, on each one of these, if you have any questions, you're more than welcome to give me a call. Thank you.
To learn more about the dental plan, click on Dental, and on the right you can see our dental program is provided for by Guardian. There's also a little quick link, a dental video you can watch on your own time. And here is the plan information. If you click on the plan information, it shows you that Comal County offers two plans, a value plan and an NAP plan. To determine which plan is better for you, you have to look up your dentist and see if your dentist is in network. If the dentist is in network, you're better off with the value plan. If your dentist is out of network, then basically pick the NAP plan. The pricing on both plans is exactly the same. I only want to point out it's either employee only, employee and one dependent, or employee and whole family. The value plan also pays a higher percentage. The NAP plan, because it's out of network, the 80%, 100%, or 50% may not be 80% of what the dentist charged, and the dentist may charge you an additional fee. Under both plans, you have a $50 deductible per person with the $3 deductible maximum per family. The program covers preventive care every 6 months. If you do not use more than $500 in benefits in any 1 year, you have a rollover amount of $250. The dental plan has a maximum of $1,000 per person per calendar year. Should you use in one calendar year less than $500, and if you had a cleaning at least once a year, then that amount is increased by $250. That means you now have $1,250. The maximum rollover amount could be $1,000. Therefore, you could increase your benefits from $1,000 to $2,000. Orthodontia is limited to $1,000 per lifetime, and under this plan, the age limit for children is 25. Now, if we go back to the benefits portal and we look at the provider list, there's a provider list provided, but it's not updated. It's from July 2012. And here it's in order of counties, therefore you can pick your county and see if your dentist is in network. Or you can go on the second page, there's a Guardian Anytime website, and you click on it and it brings you to the Guardian website. Here you check your employees, learn more, then the dental, then find a provider, find a dentist, and as you saw here, if you enrolled in the vision plan, you also can look for a vision provider. Find a dentist, then the plan we are covered is the PPO plan. And then you enter your zip code, and you will have an up-to-date search. Or you can actually enter your doctor's name, and you can see if he's in or out of network. Another choice to find out if your doctor is in network is to call your doctor or your dentist, and he will tell you if he provides. If you want to enroll or add your dependents to your current plan, you can only add dependents if they are new dependents, and you only can do that within 30 days. If you did not enroll in the plan when you were offered it as a new employee and you want to enroll later, you only can do that with an effective date of October 1st. To learn more about the vision plan, click on Vision, and the vision plan is provided for by Guardian. The plan information is right here. And again, it's a plan, it's a network program where you get the highest benefits when you get to a network provider. The cost is again per employee, then you can have one dependent or your whole family. When you go to a network provider, your exams are only $10 copay. your material is $25, and it's waived if you want contact lenses. You can have one exam every 12 months, lenses every 12 months, and frames every 24 months. You can have your dependent children covered until the age of 25. If you go in network, basically you can get the exam, single vision for nothing. If you go out of network, then you are allowed a fee they will pay, and any amount above that you will pay out of your pocket. To see if who is in network, then you basically go to the provider list, and here the providers are also in order of counties. And this was run on July 2012, or you go on the bottom of page 2, click on the Guardian Anytime, then learn more about employees, then the vision plan, then find a provider, and here find a vision provider, and you either, the plan we have is the VSP plan, and you can either enter the zip code or your street address, and it searches within a 10-mile or 20-mile or 50-mile radius. If you go to an out-of-network provider, then you have to submit an out-of-network claim form. If you go to a network provider, the provider will bill Guardian, and you don't have to do anything. To enroll yourself, here's an enrollment application. If you did not enroll yourself or your dependents at your initial hiring, then basically you can add yourself to the vision plan only once a year, which is October. Under the disability, if you click on it, you have the STD or short-term disability. The short-term disability is paid for by Comal County at no cost to the employee. If you click on plan information and look at page number 4, basically you will get a benefit of $1,000 up to $1,000 per week, minimum of $25 per week, and it will pay 60% of your lost wages. The elimination period for injury is 0 days and sicknesses is 7 days. Before you file a claim, you have to use your sick days, and if you participate in the sick leave pool, you have to use these too. Then the benefit period, they will pay up to 90 days for full-time employees. Now, the long-term disability comes in after 90 days, and if you're interested in that, you have to purchase the long-term disability yourself. To learn more about the long-term disability, go to Disability LTD, and you see Unum is the insurance company, and here's the plan information. Basically, anybody who works 40 hours per week can buy it, but as a new employee, you can buy it and there are no health questions asked. If later on you want to purchase it, then you have to answer health questions. You can buy it in $100 units, starting with a minimum of $200 up to a maximum of 60% of your monthly earnings, rounded to the nearest $100. But it cannot exceed $5,000. Then it starts paying after 90 days of sickness or injury. The short-term disability covers the first 90 days. The long-term disability covers it from 90 days to age 65. If you're age 60 or older, then the benefit period will be reduced. Then the money you receive is basically 60% of your gross income, but that money is tax-free because we are taking the premium out of your paycheck with before tax dollars. Now I'm going back to the benefit portal, and we are going to the rates. There's a little sheet in there where you basically can calculate your rates. This is one way. I will show you later another way. Let's say your rate, your annual income is $40,000. Divided by 12 is $3,333.33. 60% of that is $2,000. Now, you can buy $2,000 divided by 100 is 20 units. The rate, and you see it on the next sheet, but these are monthly rates. If you're between the age of 40 to 44, the rate is 88 cents per unit. Therefore, you enter 88 cents here. Now, 88 cents times 20 is $17.60. But this is a monthly rate. If you want to see your biweekly or payroll deduction, you have to multiply the $17.60 by 12 and then divide it by 26. Another way of calculating the premium is calling either HR or myself, and we will email you an Excel file. And basically how this one works, on top it shows in the red field your income is $40,000. Then it shows you down here that you can buy a maximum of $2,000. And here are the premium. But let's say you are interested only in purchasing $1,600. You enter that here, enter, and it shows you the premium. Again, if you're between age 40 to 44, it's $8.12 per pay period, or $6.50 for $1,600. But again, to get this form, you have to call HR or myself. Then the evidence of insurability, you have to complete this form if you did not enroll at the beginning when you were a new employee, or if you want to increase your amount. But you have to answer health questions. You need to enter your height and weight, and then there's a bunch of health questions here. Then that will go to underwriting at UNIM, and then UNIM decides if they want to insure you or not. Therefore, I recommend that as a new employee, you buy the maximum. You always can reduce it, but you cannot increase it without insurability.
So now we're going to be talking about the critical illness that Allstate offers. One thing to remember, if you are a new hire, Allstate will allow you to sign up for coverage for either yourself or for your immediate family members with no questions asked. If you fail to apply for coverages as a new hire, you may apply for coverages later, but you'll have to go through underwriting. What we're going to do is we're going to go through these steps here. Is your plan information. The plan information is basically the brochure, gives you the information on how the critical illness will work for you. Again, you notice these plans are designed especially for Comal County employees. They are group products that cannot be purchased through any other Allstate agency. We actually have 3 different categories in this particular program. So you have a category 1, 2, and 3. I'm going to give an example here. Let's say we have a heart attack. You notice we have a $10,000 and a $20,000 benefit. That's considered as a low option or a high option. So say we have a heart attack, $10,000, we have the low option. That's what it's going to do. It's going to pay out a lump sum of $10,000 because each category pays out separately. So as we notice, category 2 is going to have some other benefits, your major organ transplants, in renal stage paralysis, Alzheimer's, and then category 3 is going to be your invasive cancer and carcinoma in situ. Now, on your right-hand side here, you're going to notice your wellness. You have a $50 wellness benefit. You have 23 different choices here to pick from. Some are heart-related, some are cancer-related. Again, they are limited to 1 test per each calendar year for covered persons. So whoever's covered underneath the plan and has a wellness exam, they'll be reimbursed back for that. And I'll show you here in a minute how to file for that wellness. You also have a reoccurrence benefit on here that pays 25% of your previous categories 1 or 2. As I was stating earlier, if you had that heart attack and it happens any time period over 18 months and happens again, it's going to pay 25% of that $10,000, which is going to pay $2,500 again. Now, as we scroll down, it kind of gives you some different examples what I was just giving to you, and you're welcome to look at that. But also as far as your rates, everybody wants to know what are they paying for a plan like this. Now, if you notice, NT means non-tobacco, T means tobacco. Here's your low plan, $10,000. Here's your high plan of $20,000. So depending on whatever plan you want to go into, these are age bracketed. So each one of these are age bracketed items. So whatever bracket that you actually start off with, an example, if you start off between 36 and 49, again, this is 4 tiers. So if you want to cover just yourself, you want to cover you and your spouse, you and children, family, again, that's your option. The children are covered up to age of 26 on all of our plans. So again, once you're in this bracket, for an example, you and your spouse for $11.58, and now you're 50 years of age, it doesn't mean that your rates are going to jump to $24.22. They're going to stay at the $11.58. Now, we're going to go ahead and go back. Now, your wellness claim tips, they're all basically, you just read this information right here and it'll kind of give you a tip as far as how to file for your wellness. You also can go ahead and go online by clicking on here and register, and it gives you information of how to do that. If you do go online, you will be able to view your policy numbers, or you can contact HR. As far as a claim form, this is your claim form. So if you don't want to do it online and file it online, you can do it paper form. So again, just make sure you put your policy number here. You can always go to our website and download forms or print it out. Right here, you just go to your wellness. You click on, check off whichever test you had done. You want to make sure that your receipt basically says your doctor's name, the patient's name, the date of the test, and the exam performed. And then you're going to fax that in to us right down here on the bottom. We don't put nothing in here because we're not from New Hampshire. And right here, all we do is sign it and mailing address. Now, one thing to remember also, this plan is portable. If you quit or retire from Comal County, you may keep it at the same rate, but you must notify Allstate within 30 days of leaving employment. Again, for new hires, no questions asked. If you're an existing employee, you will have to go through underwriting. Okay, now we're going to be talking about the group cancer policy. Again, keep in mind, everything applies as was said before on the critical illness. If you are a new hire, Allstate will allow you to sign up for coverage for either yourself or immediate family members with no questions asked. If you fail to apply for coverages as a new hire, you'll have to apply for coverages later, but you'll have to go through underwriting. Again, Our brochures are located under Plan Information. So we'll scroll down here, and again, you can look at this at your own leisure. As I said before, these are group cancer policies specially designed for the employees of Comal County. Now, this also includes specified diseases, and we'll go ahead and go down to the actual brochure fact sheet that describes the different benefits. Now, on this particular plan, just like the critical illness, you will have a low option and a high option plan. Again, it's going to be your choice of whichever one you want to go to. And especially if you have cancer or in the family or immediate member of the family, this is something you might want to consider very highly. Again, you have a low plan, high plan. So it's a little bit of difference between them as far as your treatments goes and so forth, and you can take that at your own leisure and look at that depending on what plan you want to go with. One thing I want to point out to you is a couple items down here. Your cancer initial diagnosis, this is basically once a person is diagnosed with any kind of internal cancer, this is the first thing that gets paid out to you. So if you have the low plan, it's going to pay a lump sum of $5,000. The high plan pays out $8,000. But again, we're going to pay all the other benefits in addition to that. All benefits are paid directly to you over and above any other insurance. Again, as the critical illness had a wellness, this wellness is $100 versus $50, whether it's a low plan or the high plan. Again, you're going to have 23 different tests you can go ahead and get, but you get paid for one test per person per year. Your choice. Now, as far as something a little different here is an intensive care. The intensive care on the low plan pays you $300 a day. On the high plan, it pays $800 a day. The intensive care, if you're placed in intensive care for any reason, illness or accident, hypothetically, if you're in a car accident or if you had a heart attack, stroke, diabetic condition, again, you put 1 day in ICU, you're going to get paid that per day up to 45 days, first day to 45 days. We also pay for step-down units. Now, as far as ambulance, generally, if we're that serious, hurt, or sickness-wise, we're going to be either by ground or by air. And it says charges. Charges means we're going to pay 100% of the actual charges of that ground or air ambulance bill. Now, I'm aware that the county employees also carry the county pays for a air ambulance benefit for y'all. Again, those benefits are paid back to the carrier. These benefits are paid back to you as the employee because, again, all benefits are paid directly to you. Also remember that all these benefits here are also portable. So if you wanted to continue these coverages after you quit work, change jobs, or retire, you can do so, as are other products. You just must notify Allstate within the first 30 days of leaving employment. Here are your rates. Again, what it is per paycheck, whether you go with a low plan or high plan. This is a two-tier, so it's employees or family. Again, family will cover children up to the age of 26. So basically, your wellness claim tips are going to be very much the same information as what it was on the critical illness. Again, you can apply for these here online by going to allstate.com/mybenefits. You can pull up your policy numbers. As far as claim form, it's going to be the same claim form as it was on your wellness. This is the actual claim form if you had to file for cancer, ICU, or for heart. You would go ahead and go through these steps here and fill out any information. And again, if you have to file a claim and you have any additional questions, you're always welcome to go ahead and contact me underneath this information, contact information. Thank you. So now we're going to be covering our group accident plan. Click on our plan information. This is our brochure, again, specially designed for Comal County employees. Kind of gives you some different examples as far as how the accident plan works. We're going to scroll down here to our actual brochure that gives the exact benefits as far as how the plan works, and I'm going to give you some examples how this thing works. Again, this plan here will cover you 24/7 on or off the job. So it doesn't matter if your spouse works in an oil field or if the children are at school and they get hurt in a football game or sports activity, it's going to cover them. Now again, we have a low plan or high plan. So again, it's your choice. Majority of the folks carry the high plan with us because it is a better value. Again, you can kind of take it as your leisure, and you can see here you got accidental death, common carrier, and so forth. One thing I want to make sure that everybody understands is medical expenses. Where's the first place we go if we get injured? Normally emergency room. So again, we're going to pay up to $500. So let me explain up to $500. So generally your emergency room is going to cost more than $1,000, or basically more than $500. So we're going to pay the $500. But let's say if you went to a urgent care center and the bill was $350. What are we going to pay? The $350, because you got up to $500. So again, that falls under medical expenses. Another thing I want to explain is your outpatient physician's treatment visits. That's $50 a visit. You're going to go ahead and get no more than 2 visits per person per year, and no more than 4 if dependents are covered. Okay? I'm scrolling back up here to show you in writing, if you ever forget about it, as far as how this plan works. So we go right here, it says outpatient physician's treatments. So again, limit 2 visits per person per year, 4 if your dependents are covered. Now, what is that going to cover? It's going to go ahead and cover for if you're in there for sickness, accident, wellness exam, physical exam, eye exam, or a dental exam. So again, this is going to pay in addition to your health insurance or your copay. So you pay your copay, this is still going to pay that $50 in addition to that, but where is it paying? It's paying it directly to you. Again, it covers A to Z, and this plan covers anything as far as accident related, an unexpected event. So again, as I said before, I'll give you another quick example how this plan works and how I can do this. If we went to the emergency room, boom, there's $500, right? Let's say it was a simple accident and we had 2 follow-ups. So there's $100 per day. So you get two follow-ups per accident. That's $200 plus $500. That's going to be $700. Again, money paid directly to you. Again, any accidents, 24/7. As far as the outpatient claim form, again, this is step by step as far as how to go ahead and fill that claim form out. It's very simple. And as far as the claim form itself, this is it right here. So all we're going to do, there's your fax number you're going to fax it to. You're going to go ahead and get us, again, a copy of that particular receipt of what you went in for. So here's the different things I was just talking about. Your sickness, accident, wellness exam, dental exam, eye exam, so forth. So okay, these are the ones that you can go ahead and file for. Again, do not put anything here because we're not in New Hampshire. You're going to sign it, mail-in address, and obviously fill in your information here along with your policy numbers right here. Again, if you have any other information or need any other information, you can contact me right here.
To learn more about the Basic Life, click on Basic Life. As you can see, there's plan information and change form. The Basic Life is provided for by Fort Dearborn, and it's 100% paid by Comal County. The basic amount is $45,000 normal death or $90,000 accidental. If you go to the plan information, it will bring you on page 4 to the reduction of life insurance. When you turn 70, your life insurance is reduced to 65%, and a higher reduction applies at age 75, 80, 85, and 90. Then there's a change form. In case you want to change your beneficiary, you have to complete the change form and return it to the HR department. To learn more about the voluntary group life, click on it. The voluntary group life is provided for by Guardian. If you go to the plan information, you can see that you can buy policy amounts from $25,000 to $500,000. There is no cash value, and it's a 5-year term. That means whenever you turn 40, 45, 50, 55, 60, your premium will increase. Then you can buy 12 preset amounts from $25,000 to $500,000. Your spouse can buy half of your amount from $10,000 to $250,000. Your children can be covered from the day 14 to age 25 or 26 if they're a full-time student, and the maximum you can buy for them is $10,000. If you're a new employee, there's a guaranteed insurance amount of $200,000 for yourself and $50,000 on your spouse and $10,000 for your dependents. If at a later point you want to increase your amount or you want to buy an amount because you did not choose to take any life insurance when you were a new employee, then you have to provide evidence of insurability, which basically means that the insurance company could decide not issuing a policy. You also have to provide an evidence of insurability if you want to purchase more than $200,000. Then, if you purchase the policy, basically the benefits would be reduced at age 65 by 35%, at age 70 by 60%, 75% at age 75, 85% at age 80. Hopefully, at that time, you have enough money saved where you don't need it anymore. Here are the rates. Let's take an employee. They're, for example, between 45 to 49. Guaranteed issue, they can buy up to $200,000 for $26.77 per pay period. If that employee buys $200,000, guaranteed issue for that employee's spouse is $50,000, which is $669. The spouse does not have to sign any papers. Therefore, this is kind of the only time where you can buy $50,000 on your spouse without having them to sign anything. If you purchase 200, you actually could purchase up to 100,000 for your spouse, but your spouse has to provide evidence of insurability. Same if you choose to purchase more than 200,000. The rates after 65, basically as I stated earlier, the amounts are reduced and the premium is going up. If you leave the county, the insurance is portable. You also can convert at that point the policy to a whole life policy. Should you get disabled to work before 60, then your premiums are waived to age 65. Going back to the main page, here you see the form for evidence of insurability, also the rates for conversion, the conversion request form, the portability rates, and the portability request form. To learn more about AirLife or the emergency transportation, click on this and you see plan information. and it's Guardian Angel Air Life. They operate 24 hours within a 150-mile radius of San Antonio. In case you need to be airlifted, your medical insurance with Blue Cross Blue Shield covers Air Life, but an average Air Life flight from New Braunfels to San Antonio costs approximately $20,000, and Blue Cross probably pays only $3,000. With having this plan, basically Air Life will not balance bill you. That means they will not bill you for more than the insurance company paid. This program is paid for by Comal County, not only for you, but everybody in your household. Make sure you complete the enrollment form and list everybody in your household, meaning it could be your mom, your dad, or anybody living there, and they will be covered under this program. If you move or if you add somebody to your household, you have to complete the change form and return it completed to the HR department. To learn more about the reimbursement plan, click on Reimbursement Plan, and we have two reimbursement plans. One is a dependent care reimbursement. The other one is the health care FSA. And what happens is if you click here on Plan Information, you can take out your dependent care or your unreimbursed medical or dental expenses out of your paycheck before tax deduction. Like in this example here on the left, with $1,000 in medical expenses, the take-home pay is $21,500. If they're putting this $1,000 in the medical reimbursement plan, then the take-home plan is $21,750, which is $250 more a year. Contribution limits under the healthcare reimbursement under Comal County is $2,000 per year. Under the healthcare, it is $5,000. But you always have to remember, use it or lose it. That means if you did not use the money within the period or the October 1 to September 1, you may lose it if you did not use it within the 2 months and 15 days after October 15th. If you get in that position, what I recommend is get your new pair of glasses or something and use the money out of there. Then you also get a convenient debit card. That means when you go to the doctor and you have money into your reimbursement account, you show them first your Blue Cross and Blue Shield medical card. The doctor will charge you $25 copay. Now you give the doctor the convenient debit card and you pay the $25 with that as long as you have money in that account. Under this program, the charge is $2.65 per pay period. That will be automatically taken out of your account. Here are many more pages you can read up on it, and you also can call Ameriflex Direct. Here's a claim form in case you didn't use the debit card, and here's a direct deposit form. That means if you send in a claim form, they can put that money directly into your checking account. Here's a debit card brochure, and you actually get a MasterCard debit card. And you can even go to Walmart or Walgreens or CVS and pay your co-payment for prescription for this. The provider or the supplier will know that this can be used only for medical, prescription drug, or dental expenses. Then if you need an additional card, here's additional card request. Under the dependent care, you kind of have to know how much your dependent care will be every month, and then you have to submit that form to Ameriflex. If you're ready to enroll, you have to log in. And basically what it is, your username is the first 6 characters of your last name. If your last name has less than 6 characters, then basically you use your full last name. Then it's followed by the first letter of your first name, followed by your last 4 digits of your social security number. Then your password, if it's the first time you go on, is your last name, excluding any punctuation. And if your last name has 10 letters, 15 letters, you enter your full last name, followed by the last 4 digits of your social security number. Like in my example, my last name is Test, first name is Frank, and the last 4 digits of my social are 0005. Therefore, I put Test, first initial, and then 005. Then my password is my last name, full Test, and then the last 4 digits of my social. Then I'm asked to change my password. The password must be at least 6 characters in length. Password may not have following characters, and password may not contain any spaces, and the passwords are case sensitive. I made up my new password, and now save and continue. Now, there's a disclaimer. You have to read it. Now, you have an option if you want this page shown every time you log in. I like to see it, therefore I continue. Then, please review your information. Enter your street address, and your last name, then if you're married, and so on. Update all the information. Then complete your home number and work number. Also include your email addresses. And if you could put if you have a work email address, also put your personal email there. Then your status, leave that alone, then save and continue. Oh, I forgot to answer the question if I have used tobacco products in the last 12 months. And I've checked that, no. Basically, I have not used any tobacco products in the last 12 months. Some of the products you're buying may have a rate for tobacco users and some for non-tobacco users. Therefore, save and continue. Then here you can add your spouse and your children. For example, if I want to add a spouse, then you add all your information about your spouse. And again, the question, have you used tobacco products, and if the dependent is disabled. Now comes the question, is your spouse working for an employer who offers medical or RX? In my case, it's yes. Is your spouse enrolled in his or her employer's plan? She is enrolled. Now, I could enroll this spouse on my health insurance if I wanted so. If you have a spouse who does not take the insurance where they work, they cannot enroll under the health insurance under Comal County. They have to be enrolled under their employer's health plan. Then I save and continue. Then you can add children. What I recommend here, also add the children you're not planning to insure, because later on, when it comes to beneficiary, it's easy to add the beneficiary. Like here, I added my son Chris, social security number, child has resided here since, he has been here since he was born. Then you have a choice of if he's natural child, stepchild, foster child, then if he's single, basically answer all the questions, and then save. And I forgot to enter the child's gender. He is a male. Now, let's try again, save. Now, let's say that's it. Now, it carries me through all the products. Like the basic life, there's no premium, and I want to have it, therefore sign and continue. Then the medical, I basically want myself and my wife covered, and it shows me my biweekly premium. My son doesn't show up because, number one, he is over 26 and I cannot insure him anymore. Save and continue. Now, what happened, because my wife works somewhere, she has to complete this form, print this form, and return it to the HR department. Now, the GAP plan, you heard earlier what it covers, but if I want to insure myself or my spouse, and I only can insure people who are under the medical plan, then sign and continue. Then it shows me the dental plan, option 1, which is in network, and the other one is out of network. Remember, if your dentist is in network, and I only want to cover my wife and myself at $11.73, my wife doesn't want it. Then I go on. Under the vision, I want it. My wife doesn't wear any glasses, therefore sign and continue. Short-term disability. My benefit, because my income I put at $30,000, would be $346 a week at zero cost, because the county is paying for it. Make sure you select it. Then the long-term. It covers long-term disability. It covers me after 90 days, after the short-term disability runs out. And here, the maximum I can buy is $1,500 at a cost of $14.12. And remember, if you don't enroll now and you want to enroll at a later point, you have to prove evidence of insurability, and the insurance company may not insure you. Then you sign and continue. Now, I can pick the basic life of $10,000, and no, here's the available group plan, was a basic plan of $10,000. I want my wife covered there too, therefore it's $37.66. Again, underwriting form has to be completed. Now, the cancer policy, because there's family in my history in my family, I want it for me and my wife. Sign and complete. Again, there's an underwriting form. Whenever you see the underwriting form, you have to complete it and return it to the HR department, and you see the highlighted areas. Now, the group accident. I am accident prone, therefore I only want it for myself at $946. And if you want more information, you always can click here on the View Plan Outline of Benefits, and it gives you the detailed benefit information. Again, I need to complete a form, printed and completed and returned to HR. Now, the basic life insurance was $45,000. I can buy additional up to $200,000, no question asked. I'm 60 years old, therefore my cost for $200,000 is $115.38. Sign and continue. Now, if I would have wanted to insure myself for more than $200,000, then I had to complete a form. I want to insure my spouse for the $50,000. Again, $50,000 is guaranteed insurance, and she doesn't even have to sign anything. And I sign and continue. Then the legal shield, there is 3 different programs. Basically, pick whatever you want, and for me and my wife, sign and continue. Air Life is basically, I can cover myself, my spouse, and my child, even he's over 26 because he lives with us. Therefore, I cover him here. Healthcare reimbursement. What I want to do is a maximum of 10 to 166.67 per pay period. 166.67, that's $2,000 a month. Roughly calculate, me and my wife, we go to the doctor maybe 10 times, that's $25 copay times $250. Then we may have some other charges. Let's say I enter here, this is a monthly contribution. I enter $100 a month, which is $1,200 a year, but it will be calculated in biweekly. Sign and continue. Now, the dependent care reimbursement, I don't have any dependent, therefore I skip this. And basically, I have to waive it then if I don't want it. Now, on the bottom here, there's a calculator. It shows you the biweekly payroll amount. So far, I've selected benefits of $490.15 out of my paycheck. If I want to ever go back and make any changes, you click on it, you make the change you want, then sign and continue. Now, it will carry you through all the things again. Or you can go, you see, I completed healthcare reimbursement, the dependent care reimbursement. I'm still at the accident policy. Now the life, I leave everything like it is. Prepaid legal, air life, healthcare reimbursement, then dependent care, I didn't want, I waive it. Nope, I have to check it and waive it. Then the Ameriflex, because I'm doing the healthcare reimbursement, the cost is $2.65, and I have to acknowledge that. Now, beneficiary on my life insurance. Let's say if I want to add any other person I haven't listed before, but I already got my wife and my son here, therefore, apply benefit designation once for all products. Okay? Now I do finish, and I did something wrong. Because first you have to do a beneficiary. I want, and here it's pre-done, I want Heidi, my spouse. I want her to be the beneficiary. I save it. And I want her to get 100%. Now, I want to add my son as secondary beneficiary. And basically primary, my wife gets 100%, and as a secondary, in case my wife dies, my son gets 100%. Now it's finished. Now it shows me a congratulations. It shows me all the benefits I selected, and you may want to print this. The only thing is, under the medical plan, if you insure 3 children or more, the premium here will be inaccurate, and you have to talk with the HR department. Now, you can email this page to yourself, the email addresses you gave before, and scrolling back down, you're going back to the main menu and you're finished. If you have any questions, you can call the HR department, or you can call myself, Frank Witting, at 830-606-1000. Thank you.